Thank you for tuning in to another episode of Watson Clinic Health Talk. Watson Clinic started the Watson Clinic Foundation in 1960. Over the decades, the foundation has introduced a number of programs and outreach efforts that have enriched the lives of countless residents in our community and beyond. Today, one of their signature efforts is the Arts in Medicine program. Housed in the Watson Clinic Cancer and Research Center at 1730 Lakeland Hills Boulevard in Lakeland, Arts in Medicine integrates all forms of the creative arts into the healthcare setting. Research shows that engagement in these activities can be essential in creating an environment that is more conducive to healing. On this episode, we're joined by the Arts in Medicine Program Coordinator, Tiffany Van Wieren, to discuss all of this and much more. For more information on the Arts in Medicine Program, and to learn how you can volunteer your time or talents to make a difference in the lives of cancer patients and their caregivers, visit watsonclinic.com/AIM. So let's start with the concept of Arts in Medicine. When did we start that program at the Cancer Center, and what does it entail?
First of all, when you think about arts and medicine, I get funny looks because it's not two things that we typically think of that go together, right? Right brain, left brain, creativity, analytics. So we don't think of those two things typically combining or being in the same arena. But if you really think about it, since the dawn of humankind, we've been using the arts to heal. And in the last 30 years, there has been a robust amount of research, a really formidable amount of research done in and around arts and health, and how those two fields, when we combine them, impact things, not just individual health, but even community health as well. And our program, which is housed in the Watson Clinic Cancer Center primarily, started in 2008. And it really focused on how do we engage the patient experience so that it's not so isolating, and how we bring patients out of that experience of worry and stress and bring them back into themselves and really into that healing state. And the way that I always like to kind of say it is, imagine, nobody wants the phone call, right? The phone call that I think we all dread, which is, we found something in your lab work, or, the scan that you had done showed something, and we really need you to see an oncologist. Nobody wants that. You're getting the phone call like in the middle of your workday. I mean, do you finish your workday? Do you finish that grocery trip? What do you do after a phone call like that? And the reality is, so many times it starts this hurry up and wait process of healthcare. And healthcare, just in general, even on a good day, can be an extremely stressful experience for people. So let's say you go to your doctor's appointment and it's been like 2 weeks, you've been waiting and kind of building up. And we all have these expectations when we walk into a healthcare facility, right? It may be, that it's a sterile environment. People are sitting around in their chairs in silos on their phone, probably Googling the very thing that you're there for the doctor to see about. And it can be very isolating and lonely and stressful. So let's say you walk in, and the first thing that greets you is the sound as you walk through the door, because you hear somebody playing, and they're playing something beautiful. And now this isn't unheard of, having somebody play in the lobby of a clinic. So it's nice, but you go to the reception desk and you check in, right? You're like, oh, that's nice. And you go push the elevator button. But without realizing it, your heart rate has already begun to slow down, because research shows that your heartbeat tries to match the tempo of the music that you're listening to. Isn't that amazing?
That's incredible.
And it compounds too when we sing and play with others. Our breaths and our heart rates start to synchronize, which is just incredible. That's why I love this field, because we're really finding out, research is showing and proving that these things have not just effects on our emotional and mental health and well-being, but on our physical bodies. So you go upstairs, you get out of the elevator, and again, you have the expectation set. But what you see instead is people doing puzzles. And on your left, you see, what is that? Are they doing arts and crafts? And you go go up to them because you're kind of confused. And you go up to them and you say, what is going on here? What's this? And they say, oh, this is the arts and medicine area. You're welcome to wait over here. Or, we're making greeting cards. You can totally do a greeting card with us. And this is what I love about arts and medicine, is that it takes you away from that worry place, that future worry place, and brings you right into the moment. Because the first thing that most people say when we invite them to participate is, oh, no, you do not want me touching that. I am not creative. If I even look at it, it's probably going to burst into flames or something to that extent, because people don't think of themselves as creative. But it's not what they expected, right? Mm-hmm. So you're sitting there and you're talking to these wonderful people. You're not necessarily, may not do the craft itself. And you look down at your watch and you realize it's been 20 minutes. It's been 20 minutes, and this is the first time you've looked at your phone. Now, you and I both know when you're waiting for an appointment and you're anxious, what are you doing? You're checking your phone over and over again, right? And you're looking at the time like, it's been 3 minutes, it's been 5 minutes. But it's been 20 minutes, and this is the first time that you've even looked. But you're still nervous, so you thank the wonderful volunteers. Shout out to our volunteers, by the way, who are amazing. And you go, okay, I'm just going to walk around. So you walk around, and even the artwork is not what you expect. Our artwork that's throughout the Cancer Center is done by caregivers, cancer patients. It's done by community members. It's done by partner schools, all local artwork. And each one has a story to tell. And just then your name is called. And you realize the person who walked through the door is just a little bit different than the person who's going back.
Sure, yeah.
And so that's the power of our arts and medicine program in-house. And so when I first stepped into this role, I realized, first of all, that this is an amazing, wonderful thing that I think should just be everywhere. But that we were the only arts and medicine program in a clinical setting. And we were the only arts and medicine program in all of Polk County. Mm. And for me, this is such a wonderful combination of fields. And because it's part of the Watson Clinic Foundation, it seemed a natural fit for us to be a leader in this field and kind of help our community come together around educating around arts and health. Mm. So we began to reach out. We looked at organizations that we could be a part of. We quickly became part of the Mayor's Council on the Arts. And we really kind of looked at, okay, how can we partner with organizations to make more of an impact? Our types of programming include, first of all, our clinical programming, which is around patient care, but is also around staff care as well, because when you integrate arts and health, it reduces burnout and turnover.
Yeah.
Because healthcare is a very stressful field, and it has a high burnout rate. And so, especially post-pandemic, right? So then our other side is our community side. So the first thing we really looked at was, okay, which kind of programming do we want to start with? So we started with a grant from the Florida Breast Cancer Foundation, and it allowed us to do a survivorship workshop series. Now, this is a very unique sort of experience and approach to survivorship, because we didn't just bring people in to educate them about survivorship or do a talk therapy group or any of those things. But it fills the need of those, because a lot of times, we're getting better, first of all, at treating breast cancer, because we catch it earlier, which if you haven't gotten your mammogram, please go do that. And so we catch it earlier. We've gotten better at treatment options. But that means we have a huge, huge group of survivors. And so often what we hear from breast cancer patients is, I felt like I had this great framework of support while I was going through treatment. And then you go and you ring the bell and the doctor's like, okay, see you in 6 months. And it feels like the bottom drops out.
Right. There's a void.
Yeah, exactly. And so you have all these questions and you're like, I don't even know what to do with this. Like what? And there's not a lot of resources for survivors, especially in that first 5 years. So we designed this 4-part series. And the first one is with one of our oncologists, one of our nutritionists. And the cool thing about that is all those questions that you don't have time for in a little 10-minute, office visit, they get to ask all those questions. And what inevitably happens, it's always kind of nerve-wracking for everybody sitting around in the group. for the first like 15 minutes. But there is a magic that happens in these groups. People that wouldn't necessarily go to a talk group or wouldn't, because that's very vulnerable, right? Just like, let's sit in a circle and share our feelings. It doesn't necessarily scream, oh, I want to do this.
Right.
So the great thing is about halfway through, inevitably, these women start talking with one another. And I feel so grateful just to be a part of the experience because these women are amazing. And every single group teaches me something. So then they get to take a class with at the Ashley Gibson Barnett Museum of Art, which was formerly the Polk Museum of Art. They get to take a class with Satya Life Yoga and with Lakeland Garden Club. Now, each of these different things, art, gardening, and horticulture, and yoga, movement, have all been shown to help in survivorship. But through these experiences, and a lot of times these women end up hanging out afterwards and talking, they're learning by doing. Mm-hmm. And the cool thing about partnering with these organizations is that well beyond the workshop experience, they can continue in doing that. So let's say you take one class at the Ashley Gibson Barnett Museum of Art and you love it. And so you can still go to those classes because they have them all the time.
Yeah.
You just get to be able to try it. It's like a try everything, right? Let's try what's going to work in my new life, right? So we have a lot of programs kind of like this, that really we're looking at how can we bring together our community, how can we incorporate the arts into our healthcare experience just to make all of us healthier and happier.
There's a lot that you just said beautifully descriptive about the patient experience and how they encounter arts and medicine that I want to drill down on. I would imagine maybe the most profound component of this is just the camaraderie, that you're surrounded with others that understand your journey.
Yes, absolutely. Cancer is something that has touched, I think, every life. You know what I mean? Whether it's directly or indirectly, we've all been touched by cancer. But it's such a beautiful thing for these women to connect. In fact, one of our participants in our first class, our first cohort, she goes, I never wanted to even associate with the word survivor. And this group helped me to take that word back because I didn't fully understand what it meant. I thought it meant that I was barely scraping by. And now I realize that I'm a warrior. That is living, that it's being a survivor.
It's thriving.
It's thriving. Yeah. It's embracing this life. And it helped her completely redefine the word. And it's through that talking and through that shared experience. And I think that's what's so beautiful about the arts in general is that they are a doorway to many of the problems that we have in the healthcare experience, which can be very disconnecting, right? When we utilize the arts, it helps us to overcome barriers. It helps us. It really is a doorway or a bridge between two different worlds, and helps us to see ourselves, to see each other in different ways.
Mm-hmm. And in terms of what the research says, you spoke earlier about in the past 30 years that there have been a robust number of research studies on this. What are the most kind of surprising or illuminating statistics or anecdotes you've come across when it comes to that research?
So there's several studies that I really like to quote. One is where they put artwork in hospital rooms. Mm-hmm. I love this one because it's so interesting. What they found was the people who had art in their rooms got out on average a whole entire day earlier than their counterparts. Which is crazy. And that can, if every hospital implemented that could be $53 billion in savings annually, because you think of how much one day of hospital care costs.
Yeah.
There's an Arts on Prescription program in New York City, and they actually just got done with their first level of research for their first year, I think. And for them, they found that those who were participating in the arts prescription program had a 70% reduction in ER visits. And I think there's a lot of reasons for that. I mean, I think part of it is just because it helps us we're moving. A lot of times with arts, you're moving, you're connecting. When you think about loneliness and its health impacts, 1 in 6 adults has marked loneliness. that loneliness translates into increased risk of cardiovascular disease, dementia, increased risk of stroke, and not by like 6-7%, like by like 50%. I mean, it's very staggering statistics. Wow. It's equivalent to like smoking, was what the Surgeon General has said. If we can reduce that loneliness and through connection, which the arts are a beautiful doorway. Sure. It can add up to 7.5 years to your life. And the arts are a pathway for that. So there's so many. There's ones with for Parkinson's patients and how it can help increase mobility. There's ones for dementia patients and how you can increase neural pathways and help bridge some of those things so that you're having extended periods of memory.
I've seen that with dementia patients. Those videos, particularly when it comes to their connection to music.
Yes.
It's a very powerful force. Yeah.
And if you think about it, it's because music, when we're listening to music, and there are times in our lives, and I think everyone can connect with this, there are times in our lives where what we're feeling is so profound we don't have words for it. Mm-hmm. But there's almost always a song that meets us in that place. And so those people that come to us at the Cancer Center, and they're like, I'm not creative, right? Mm-hmm. I think we confuse creativity with artistic talent, first of all. All of us are creative. And that's because creativity has nothing to do with perfection. It has everything to do with connection. So some of the most meaningful artwork that you may create may look like scribbles on a paper to somebody. You take colors, you're feeling frustrated and angry, and you scribble colors that represent those feelings on a paper. You just scribble, right? It doesn't look pretty, but those words that you can't find, they're on the paper. And so that's where being creative comes in. It doesn't have to be a Pinterest perfect, piece of art. There's a place for that, and those things are wonderful to look at, and we all experience the beauty of artistic expression. But we don't, as people, we don't have to have perfection in order to create. And I think part of it too is we also just, as adults, think I have to have something come out of it. Like for it to be of value, it has to have a success metric outcome, right? Mm-hmm. And it starts when we're little. What grade did you get on the test? And in adulthood, did you make those quarterly, requirements, those quarterly goals? But in reality, when we can embrace that messiness of creativity, it frees us in so many ways when we free ourselves from that expectation of perfection.
When you're very engaged in a project, it keeps you laser focused, and the stress kind of melts away because you're so in the moment. And they talk about that a lot when it comes to the creative arts, being in the moment.
Yes.
And I love what you just said about the difference between being an artist or just simply being creative. It really is. I mean, art comes from personal expression, from your personal experience and perspective. And even thinking about singers, there are some singers that they have all the vocal gymnastics, they clearly have great voices. But the singers that I like are the ones where you could hear the life lived. And they might not have the most perfect voice, but you can feel it. Yes. It's personal to them.
Oh, yeah.
That's
we could have all the technique in the world, and it falls flat.
Right.
There has to be something for somebody to connect to.
Yeah.
And I think that's the power of the arts. It's something that we can all universally experience. It's something that touches us, all of us. And one of the interesting things about music specifically, whereas art is can be very effective just in general, like because we're using our hands and we're, if we're engaging in art. Music is very interesting because if you don't like it, it does not have the same benefits necessarily as if for music that you don't. So, for example, all those wonderful feel-good hormones that we get that release when we're listening to a good song soundtrack that we love, we're not going to get that same feedback in our bodies if we listen to something that's like, something that we never listened to. It's because the way that our brains hardwire in connection to music. So when we are engaging in these things, one of the things I didn't kind of talk about is how it affects us physiologically. Mm-hmm. I did kind of talk about the heartbeat, but part of what happens when we are stressed or anxious or living in that future moment, right, that is causing us worry, is that our cortisol shoots up, right? Our blood pressure shoots up. And all of these things wreak havoc in our bodies. It can increase inflammation in our bodies. It can increase pain. And when we engage in the arts specifically, it helps to, increase those wonderful feel-good hormones like dopamine, those natural painkillers of our body that reduce the cortisol, that reduce the blood pressure, that help us to really bring our bodies back to like a neutral state. And the cool thing about that is that, and this is where music therapists are amazing and art therapists are amazing in hospital environments, because patients who are able to incorporate that into their healthcare experience typically need fewer pain medications.
Wow.
And improve more quickly. And if you think about it, it's just because we're removing those barriers of that hiked up cortisol and that higher blood pressure. Just doing that and releasing those natural painkillers into our body, those natural hormones into our body, just helps the process of the medicine, right? Medicine obviously is, we are so grateful for, because we've learned so much, and we learn every single day new ways to heal the body. But when we incorporate the arts, it's like bringing a friend alongside you. It really helps to exponentially increase that process and make it more effective.
Yeah, it facilitates better healing and potentially better outcomes with your treatments. So what have you heard from people that have gone through your program and then they finished their realm of treatment? What have they told you about the meaning of arts and medicine to them?
So we get a lot, and it's funny because sometimes I don't always know what happens to patients, because I see them at the cancer center or through our survivorship program, and then every once in a while I'll see somebody out in the wild, as I like to call it, or they'll come back specifically to tell me what's happened. And I have a couple of things happen. So people first of all ask me, if my volunteers, when they first come in, go, I don't know, is it a sad place to volunteer? And inevitably, after their first day, they're like, this is not sad at all. This is so joyful. It really is a very joyful place to be. And it's because the impact that you're having is so profound. So, you get patients that are coming on their first day, and they had that experience. Like I said, they walked in, and maybe they did sit down and do the craft. And they're like, oh my gosh, I so needed this today. And they're totally engaged, and I can't believe they have something like this. This is so amazing that this is here. We had people come over just specifically to tell us, this is so amazing. I love you guys being here. And then you have patients that aren't as open to it, and who may come in very, very, with their very guarded and very almost defensive, in a defensive place. And, not that that's a bad place, because that's probably where a lot of us would be. And they sit in our area because there's no place else to sit, because we are very busy. Like the Cancer Center treats, we have up to 52,000 people walk through our doors every year. And so they come in and they sit in our area. They're maybe very unhappy about having to sit so far from the door, and they're just kind of there. And eventually, as they're waiting, this is the most touching for me, is that if I'm able to engage them and have a conversation with them and bring them into this moment, and get them into engaged in the arts that way, it is a really wonderful experience, because I know that they're walking away a little different. So, and of course with our survivorship group, I know that some of them get together afterwards, which is really, really great for me, because I'm like, I love that they get together well beyond the workshop, because the workshop is just 4 classes, but to know that they get together beyond that, and then to see our alumni come back for, like this coming up year, I'm hoping to have like an alumni kind of reunion from all our classes, because I've seen them out in the wild, and they're like, I would love it if we could get together again, just to to have an experience together. So it's definitely something that they say it's like a green light to start their survivorship, is one of the things that people have said.
So in terms of the activities, when there's guest musicians who come in and volunteer, there's There's painting, craft work.
Yeah, so we do a bunch, really a bunch of different kinds of things. We do collaborative art pieces. So that's everything from like our Zentangle projects, where we have big Zentangle, which is like a repeated patterns type of art. And you can sit and grab a little block. They're puzzle pieces that come together. They're like the 4x4 little wood block pieces that all come together to make a bigger picture. And then, so we have those. We do one of those a year. We do big quilling projects. We do one of those a year. We do watercolor, painting rocks, jewelry making. We have, of course, musicians that come in. We actually even have we have a beautiful ocean drum that patients can use. And if you've never used one of those, it's very cool. It's pretty big. It's probably about 30 inches, I think. It's a larger ocean drum. And ocean drums, they're inside, they have like little beads, and it sounds like an ocean when you slide it back and forth. I should have brought it because then I could have done it on the podcast and they could hear it at home. So anyway, so it goes back and forth and it makes an ocean sound. So we have a couple of instruments like that that patients can even play, and it sounds beautiful and it's relaxing for everybody around.
Oh, wow. And you guys have a gallery. There's galleries of artwork created by the people associated with the program, and at all times, right? There's display there.
Yeah, so we have a partnership with Rochelle School of the Arts. And so we had a really cool exhibit this past year that we just took down, which was Pets and Hats. And so their middle school group all did, hats, pets and hats. And so there was really, really cute, and patients loved walking around and seeing those. And then we also have community artists that come in. We actually have formalized that process. And so we're going to be beginning this next year to have 2 all calls a year. And so the process for that will be, there'll be a prompt, and artists can submit their work to be showcased for 6 months. The first prompt is going to be the art of melody. And so artists will choose a song that inspires them for their artwork. And what we'll do is we'll actually have a QR code so that patients can listen to the art, or to listen to the music that was chosen as they're looking at the art piece. So it's a very fully immersive kind of experience. And so we're going to be doing that. And then we also have just patient artwork throughout. It really is. And if you've ever come, hopefully you don't have to come to the Cancer Center, but if you ever do have to come to the Cancer Center, either with a friend or for yourself, we have ceiling tiles that have been painted by patients. So, if you're sitting there getting an infusion, you can look up, and we've had several patients talk about how inspiring it is to be able to just look at the artwork as they're sitting there. Yeah,
it is powerful. I've seen it, and over the years, I know it's meant a lot to people, those ceiling tile art pieces. As arts and medicine has gained exposure, and more people in the community have become hip to its effects, its impact, tell me about the partnerships that you formed in the community.
We started to reach out, as I said before, to other organizations throughout the community, and just kind of really saying, hey, we want to look at how we can be healthier and bring arts and health intersectionality. And so one of the ways that we're doing this is we've started to build an arts and health consortium. So this is a group of just like-minded organizations that are just willing to say, hey, we want to find ways to be intentional about this next leap forward. Polk County is one of the fastest growing counties. It is the fastest growing county in the state. It's one of the fastest growing in the entire nation. So we are rapidly growing, and there's a huge need that comes along with that. So, being very intentional in this next phase of Lakeland's growth and of Polk County's growth, and saying, hey, how do we, do this well and help make our community the healthiest place it can be? And I think we're very lucky. We are very, very lucky here in Lakeland, because we have so much an arts presence. Even, things like Winter Haven, we have Lakeland Community Theater, we have Lakeland Symphony Orchestra, we have the museum. We have all these wonderful murals throughout the city. We're kind of an artsy city. what I've found, and what we found when we started having these meetings about an arts and health consortium, is that these organizations weren't just like, oh, okay, well, that sounds interesting. No, it was wholehearted embracing of, yes, let's be intentional. Let's do this. Let's make this, happen. How can we work together? So one of the ways that we've done that is this year, the Arts for Everybody campaign, along with the National League of Cities, challenged each city to declare July 27th as Arts and Health Day. And so Lakeland did do that. It declared Arts and Health Day. And a lot of our organizations, our founding organizations for the Arts and Health Consortium, went together, and we all accepted that proclamation. And we decided to do a whole week of arts and health education. And at the end of the day, over 21 organizations participated in this. And we've even gotten a grant from the Polk Arts and Cultural Alliance for this next year to make that an even bigger impact for that.
That's great. So when people hear this and they see the kind of the things happening with the Polk Art and Cultural Alliance, is that what it's called?
Polk Arts and Cultural Alliance, yes.
Okay. And they want to help. What kind of volunteerism are you looking for arts and medicine?
So I always like to make sure that I have lots of places for people to volunteer. So we have our in-person volunteers. So that's people that, work at the cancer center itself, and they're in the studio space, or they're downstairs in playing music. So if you're a musician,
and you guys have a piano there in
yes,
the
we
facility.
do have a piano there, and we have a baby grand piano. So we have musicians that come and play, but we don't just accept pianists. So we've had, we've had all sorts of instruments at the cancer center, and it's a really great space to play. And then so that's our in-person, right? But I recognize that not everybody is able to come in person. We also have volunteers that make things for us. It's very cold in the cancer center, especially if you're getting an infusion. And so we have people that make or buy blankets and things like lotions and chapsticks and bring those in, or make hats or port pillows. Port pillows are little pillows that wrap around your seatbelt. So if you have a port, which goes into your chest, that's very sensitive. And so it helps to kind of make it so that your seatbelt isn't rubbing directly up against your port. So we have volunteers that make things. And then we have volunteers that do make and takes for us. So our make and takes are little ready-made crafts. So it may be a jewelry kit, and it has everything that you need to make an inspirational jewelry bracelet. So like it has a word with letters, it has the string, has the directions, and it all goes into a bag so that if you get called back and you're there for 6 hours for an infusion and you've brought your things, but it's always good to have, something else to do. They're able to grab one of those take and makes and go and bring it with them and work on it in the infusion lab or work on it at home. We've had people that have done that as well. So we have volunteers just kind of across the spectrum. And then we have volunteers that come for special occasions and do special things with us, like the Survivorship Workshop Series. And then we have, people that help make those things financially possible, or people who donate items that we use every single day at the Cancer Center, like our watercolors or our coloring books, or, those kinds of things. It takes a village. It really does.
And I think you alluded to this before. Beyond the patient themselves, caregivers take part in this. There's the people that are accompanying the patient to their appointments, and
absolutely. And a lot of times, the caregiver doesn't necessarily go back with them, and so they'll be just kind of sitting and waiting. And so that's a wonderful opportunity for them because it really is. There's no guidebook for a caregiver, right? They're trying to hold it together for their person. And for there's the support. And so doing that is incredibly difficult. So being able to, have the arts or have those kinds of releases is incredibly important.
Mm-hmm. So the breast cancer survivorship workshop. There are two different tracks. There's a Tuesday track, there's a Thursday track, whichever one's more convenient to your schedule. And you kind of ran down the 4 different classes that are in each set. The new workshop series starts in January next month. So I would recommend you go to watsonclinic.com/survivorship, and then you can find more information on the class schedule there, and you can apply. And what are the qualifications?
So you have to be within your first 5 years of survivorship based on the date of your diagnosis. So whenever that diagnosis was. And then I'm hoping that in years to come, we'll be able to kind of expand that a little bit more. And right now, we limit it to 20 people per group. Because beyond that, it gets a little too big, right? And 20 people seems to be the right kind of number. That's pretty much the only requirement. And other than you have to live in Polk County. So,
Okay.
Be a resident of Polk County.
Okay, watsonclinic.com/survivorship. I know there are other things going on that you're.
Yeah.
So fill me in. I don't know what I'm missing here.
So we are, along with our community art that I'll call it, we'll be doing. We're actually working. We got another grant from Polk Arts and Culture Alliance. We were actually received 2 grants from them. One for the Arts and Health Week for this coming up year, and then one for our Legacy Lane project. Last year, I went to the National Organization for Arts and Health conference, and they had a tour at Metro Health, which is gorgeous. It's a gorgeous facility, and they've been so intentional with how they've incorporated arts into the healthcare experience. There's art everywhere, and it's beautiful. Everything is so aesthetically well thought out. They have a trauma ward, so these are people who have lost limbs, who have experienced physical trauma to their bodies. And as you can imagine, as part of the rehabilitation, they're having to walk the halls quite frequently. In the halls that they walk, they have pictures of people post-trauma. So after their trauma, in their survivorship, and then their stories are captured right there. So as these people are walking in the midst of their trauma, they're seeing these inspirational stories of what comes after. And immediately I thought of our patients. I thought, oh my gosh, because so often when we see cancer patients depicted, it's mid-treatment. And while that is powerful and impactful and important, when you're in the middle of treatment, you want to know what comes after. You want to know that there's something after this. And so we're doing this, it's Legacy Lane is what it's called. And it will depict 5 of the top cancers. And they're survivors. So it'll capture their story. We'll actually capture their stories. And we have a professional photographer who will be taking their photos, doing a professional photo shoot. And those pictures, that exhibit will actually hang at the Cancer Center and will eventually be a traveling exhibit.
Along with their stories.
So,
yes. Current patients can look to those and think this is the embodiment of what I'm working to achieve.
Yes.
And it serves as an inspiration for them. That's beautiful.
Oh, yeah, absolutely. And just kind of knowing that there is something, there is a next step. Because in those places, it can be very difficult to hold on to that. Mm-hmm. So that'll be the early first quarter of 2025 that you're working on that? Yes, that's what we're working on the first quarter of 2025.
Okay, Legacy Lane Project.
Legacy Lane Project. And if anybody would like to, we will have that up, not just yet, but we will be recruiting for that pretty soon.
Okay.
And you can find information about that on just the watsonclinic.com/AIM, so Arts and Medicine. And that's just our Arts and Medicine page. And so we always have information on what's happening up there.
Tell me, for you personally, the most fulfilling part of what you do.
I love impact. I love being able to, and I describe it as magic quite frequently, because it really does feel like I get to be, not that I'm doing something magical, but that I get to be a part of something magical. I was a teacher before in my past life. I was a teacher. And so, working with kids so easily embrace that magic, right? They encapsulate it, they're willing to try anything. They're willing to, do it and play and have whimsy and have these experiences that as adults, we don't allow ourselves to do. And so being able to help an adult kind of cross that barrier and engage in whimsy and play and free themselves. This is the big thing. Free themselves from the expectation of perfection is so powerful. So I love that part of it. So that kind of impact and having that kind of impact in somebody's life, but also in our community. I mean, having Watson Clinic Foundation as, this arts and medicine is part of Watson Clinic Foundation, and understanding that it's such, even the World Health Organization says arts are, very important for our overall health. So understanding that I work with an organization that prioritizes that whole person, and not just my lab results, but like the whole person, because it really is all of us, right? That to me, being able to have that impact on my community, on individuals, that's where it's at. Yeah. If I could do that day in and day out for the rest of my life and be totally happy.
And you're doing such meaningful work, and you're making meaningful connections.
Yes.
And I've heard from our doctors too, many of our most popular doctors, and they talk like you did earlier. They say, I'm out in the community, and I can't help but bump into people that look at me like I'm a member of their family.
Yeah.
That must be very satisfying.
It is very satisfying, and it's just a wonderful thing to be able to be part of that experience. It's funny because in my role, our doctors are so amazing, and I don't know that I could ever do what they do. They're just amazing at what they do. For me, I get to bring the joy so often in what I do, and so it really is just a very meaningful experience. So when people see me, they equate me with like this happy thing, right?
Yes, that's beautiful.
So that's a really beautiful, being a part of that is really special.
Well, it's been a pleasure. Thank you so much for joining us today.
Thank you so much for having me.
That's it for this episode of Watson Clinic Health Talk. For more information on the Arts and Medicine program, don't forget to visit our website at watsonclinic.com/AIM. And if you like what you heard in this podcast, please consider leaving us a positive review or subscribing to our show wherever you get your podcasts. Till next time, thanks for listening.